experts who provide key facts while the president does not.
You can call it a germ, you can call it a flu, you can call it a virus. You know, you can call it many different names. I'm not sure anybody even knows what it is.
It's very, very much more transmissible than flu. And more importantly, it's significantly more serious, which means it's at least 10 times more serious than the typical influenza.
Anybody that needs a test gets a test. They're there. They have the test.
The system is not really geared to what we need right now.
And the tests are beautiful. Anybody that needs a test gets a test.
We are not there yet because otherwise people would be never calling up saying they can't get a test.
I think Easter Sunday and you'll have packed churches all over our country.
You don't make the timeline. The virus makes the timeline.
Now, this is a drug called chloroquine. It is known as a malaria drug, and it's been around for a long time. If things don't go as planned, it's not going to kill anybody.
There are no proven safe and effective therapies for the coronavirus. There's no magic drug out there right now.
Okay. Now, the virus that we're talking about having to do, you know, a lot of people think that goes away in April.
We will see more cases and things will get worse than they are right now.
We have a total of 15 cases, and the 15 within a couple of days is going to be down to close to zero. That's a pretty good job we've done.
Looking at what we're seeing now, you know, I would say between 100 and 200,000 deaths.
Trust me, I'm like a smart person.
Do we have enough masks? No. Do we have enough tests? No. Do we have enough PPE? No.
Why would you say no?
Do we have enough medical equipment?
The answer is yes. I think the answer is yes. Who said no to that? I said, do we have enough masks?
Does the country?
Yes. Do we have enough tests? Yes. Do we have enough ventilators? Yes. Do we have enough hospital beds? Yes.
Well, what do you say to? I mean, you watch the coverage.
You know what I say?
Watching a lot of the coverage.
Well, a lot of it's
These
fake
doctors
news.
No.
A lot of it's fake news. A lot of it's fake news. You shouldn't be asking that kind of a question. They've done a fantastic job, and when you ask a question like that, it's very insulting to a lot of great people.
我有位好朋友，他是在美国最大最好的医院，就说现在口罩非常非常的紧缺。我当时的话呢，说啊，我就有一盒这个就是3M 的医用口罩，我是不是给你寄过去？我当时绝对没有想到他会要，因为我觉得他是医生，而且还是在负责人，他马上就说你能不能给我寄过来？很惊讶啊。
You talked about couldn't it lead to death, meaning you open up could lead to death, and you're right. But you know what? Staying at home leads to death also. It's very traumatic. You look at numbers, that leads to a different kind of death perhaps, but it leads to death also. I'm going to have to make a decision, and I only hope to God that it's the right decision.
Oh, God, please, no! No!
Well, what do you say to the 16 million Americans, more than 16 million Americans who have lost their jobs in the last 3 weeks and fear that the economy won't just bounce back, like you said?
Well, I think the economy is going to do very well. Now, that's just my feeling. It's a strong feeling. I've had good, proper feelings about a lot of things over the years, and I think we're going to do well. We're doing it looks like I think that what's going to happen is we're going to have a big bounce rather than a small bounce. But we will be back, and I think, honestly, I think our country is going to be back from an economic standpoint. Again, I think we're going to open up strong. I think we're going to open up very successfully. And I'd like to say even more successfully than before.
日本人靠不住，我靠谁呀？老蒋，更靠不住。一个写日记的人，
正经人谁写日记？
是啊，
你写日记吗？
我不写。你写日记吗？
谁能把心里话写日记里？
写出来的那能叫心里话？
下届。
Once again, we ought to celebrate all of this. Fewer hospitalizations are a godsend for this country. And as awful as this epidemic has been and will be, at least so far, it hasn't been the disaster that we feared. Our healthcare system hasn't collapsed. That was the key concern. Except in a handful of places, really it hasn't come very close. Patients are not dying alone in the hallways of emergency rooms with physicians too overwhelmed to treat them. That was the concern. It happens in other countries. It's not happening here. Thank God for that. All of this means that the short-term crisis, the ones that we worried about so fervently, in which pressure on hospitals grew so exponentially day by day with no end in sight, that short-term crisis may have passed. We'll see, but it looks like it may have. Now it's time to look ahead. If the virus is doing less systemic damage to our system than expected, then presumably we can begin to consider how to improve the lives of the rest, the countless Americans who've been grievously hurt by this, by our response to this. How do we get 17 million of our most vulnerable citizens back to work? That's our task. Other countries are already hard at work doing it.
There are people who pass away, and there is no family member, no loved one, no friend, no one who we can find has a connection to that person and is going to take responsibility for their burial. The city of New York steps up and says, okay, that person will be buried at Hart Island. It's any kind of person who passes away. This is not a new procedure, is what I'm trying to make clear to you, but more people are passing away, obviously, in large measure because of COVID.
We're saying things like, I think it's a problem that's going to go away. Within a couple of days, the cases will be down to 0.
Well, the cases really didn't build up for a while, but you have to understand, I'm a cheerleader for this country. I don't want to create havoc and shock and everything else, but I'm not going to go out and start screaming, this could happen, this could happen. So, again, as president, I think a president has to be a cheerleader for their country.
If you had said to me what would ultimately have my mother fall, I never thought it would be some virus, and it is still hard to get around that. But look, in New York City, this is playing out in so many families, and I got to tell you, Donald Trump has blood on his hands, and he has my mom's blood on his hands, and he sent us a hospital that's right here in the Manhattan Harbor, and no one can get on that hospital. The government's supposed to protect our people, and we're supposed to be able to protect our parents and grandparents the way they protected us, and we're not able to do that.
Making the claim without really any evidence that these deaths are being padded, that the number of COVID-19 deaths are being padded.
Just to add a comment to that, because, having been through other serious issues, particularly the very painful early years of HIV, AIDS, when people talk about conspiracy theories, you will always have conspiracy theories when you have very challenging public health crises. They are nothing but distractions. I can assure you, we have so much to do to protect the health and the welfare of the American people that I would just hope we just put those conspiracy stuff and let somebody write a book about it later on, but not now.
Today was a really rough day. I'm tired of walking into rooms and your patient's dead. There's a dead body there. I feel so much sadness for my fellow nurses that have lost their life taking care of people. I don't think people understand how stressful this job is. Sometimes I think people just forget we're human too. I don't know, I just feel like people think just because we're like a healthcare worker that we are somehow immune to this and we're not. It's almost 10 o'clock at night. I have to be back at work at 6:45 and
we don't blame Trump, we blame China. The Chinese government's responsible for 16,000 American deaths and 17 million Americans being unemployed.
What? We have things in the works that are going to really, I think, fire the country. I think that what's going to happen is we're going to have a big bounce. Big bounce.
Continue to study the spread of COVID-19. They're recommending that people wear cloth face coverings in public settings where social distancing measures can be difficult to maintain.
Go straight into the hotel, grab your bags.
Do you feel like China withheld critical information from the United States, and will there be any consequences for that?
This is not the time for retribution, but it is still the time for clarity and transparency.
美方研究人员正是利用中方分享的病毒基因组 才研发出疫苗的。中方已经做了我们能做的和该做的事。
It's personally targeted to me. 3 months in the same situation. But still, they can continue. I don't care. But I assure you, we will do everything right in WHO.
Become necessary, and what role did you have in this, sir?
Well, I had no role in it. I've heard, I don't know him, but I've heard he was a very good man. The whole thing was a very unfortunate. The captain should not have written a letter. He didn't have to be Ernest Hemingway. He made a mistake, but he had a bad day. You're in the military, you're the captain of a great ship, and you shouldn't be writing letters and sending them to many people, and then it gets out to the media. The question is, how did it get out to the media? I had heard he did because he didn't want to cause any disturbance for our country. So that was because he wouldn't have had to resign. I would not have asked him. I don't know him. I didn't speak to him. But he did that, I think, just to end that problem. And I think in really many ways that was a very unselfish thing for him to do.
When you look back at this, where were the horns that should have been triggered back in December and January? Where were the warning signs? Who was supposed to blow the whistle? The president has asked this question, and I think he's right. The president's answer is the World Health Organization should have been blowing the whistle. I don't know enough to know if that's right or wrong, but I know the question is right. And sometimes the question is more important than the answer. How did this happen? I mean, I still want to know how this happened, because the warning signs were there. And if you don't know the answer, then how do you know it's not going to happen again? Right? Fool me once. January, you go back and look at the headlines in January, and you see questions, and you see warnings. Now, they were all over the map, but we saw what was happening in Asia. We saw what was starting to happen in Europe. Where were the international experts saying, well, if this is happening there, this is what we should expect to happen in the United States, or prepare to happen in the United States? January, February, you still had sources in this country saying, basically, there's nothing to worry about. How did that happen? And did we really need to be in this situation where the United States winds up with a higher number of cases than the places that went before? We sat here and we watched China. China winds up having 84,000 cases. We wind up having 474,000 cases. I mean, how does that happen? We saw South Korea. They wind up with 10,000 cases. Italy, where we saw a collapse of the whole health system, winds up with 143,000 cases. I raise the question because the answer, again, is less important than the question. But before we move forward, let's make sure we're not repeating the same mistake that we made, right? George Santayana. Those who do not remember the past are condemned to repeat it. I don't want to repeat what we just repeated.
Oil?
Yeah.
Where is it today?
Well, I was wondering if you...
No, where's the price? Give me the price.
I'm not sure, to be honest.
How can you ask a question when you don't know the price?
I'll look it up for you.
Okay, let me do somebody else.
俄罗斯对中国公民是保护的。我想跟大家强调的是，今天俄罗斯的外交部正式的向使馆反馈，经过向俄罗斯有关的强力部门了解，目前没有中国公民遭到拘留或者因为签证问题受到俄罗斯强力部门限制的案例。我们希望大家呢，通过使馆的网站和微信平台等其他的媒体平台了解准确的信息，而不是听信谣言。
Nope. Yep. Nope.
喜欢我的视频不要忘记点个订阅哦，谢谢你们。